I want to officially open the meeting and ask Wanda to take the roll call again.
Okay. Oops, wrong page. Should have gotten that second cup of coffee this morning. James Oleski.
Here.
Rebecca Artman. Lucinda Bateman. Ron Glazer, not here. There it is. Arthur Hartz, not here. Chris Healy. Here. Leonard Jason. Nancy Klimas. Jason Newfield. I know he's here. I think he may be around the corner. Morris Papernick. And Christopher Snell. Among the ex officios, Michael Miller.
Here.
Mark Cavalle-Cole.
Here.
Deborah Willis-Fillinger.
Here.
Eleanor Hanna.
Here.
Mike O'Connor as the alternate for Social Security.
Here.
Very good. A couple other housekeeping notes for those of you who were not here yesterday. And I forgot to announce yesterday, please, as a courtesy, leave your cell phones on the vibrate, mute, or off position. It was great yesterday. We had no interruptions, and I think everybody's been around that tree enough times, and I appreciate that. Restrooms are outside past the elevators to the left. The staff can make sure you're there, and you must be escorted in this building, but you can reach those restrooms most easily. Just ask a staff member to show you where they are if you were not here yesterday. In addition, as you know, this is being webcast, and at our last report yesterday, I've not seen the final report, but at our last report, there was a total of about 400 people who had viewed the webcast, which was just fabulous. Compared to the spring, our first ever webcast, where we had about 107 on the first day and then 70-some on the second day. Obviously, the topics yesterday, but to see 400 viewers is just phenomenal, and it tells us clearly that proceeding with the webcast was the right thing to do, and we are committed to making this accessible at future meetings of the Chronic Fatigue Syndrome Advisory Committee. There is water in the back of the room and cups, and then a rest area for those who just need some privacy. If you need to lie down, there are some mats. There is a table with some chairs that can provide some support if need be. And then the agenda for today. Dr. Willis-Fillinger was not able to be with us yesterday morning during the ex officio reports, and so we will divert for a few minutes for an update from HRSA. And then at or around 11 o'clock, Dr. Jerry Holmberg from the Office of Public Health and Science, Office of Blood Safety, will be here to talk about the blood protection process and the how we get from where we are now, for example, with XMRV to protection of the blood supply. So he will be here at 11 to share that information with the advisory committee. All public comments will be posted. We do have to ensure compatibility with all of the screen readers for people with visual and other impairments. So sometimes it takes us more than just a few days to get all that testimony posted. The webcast, likewise, also is closed captioned. But now, what did I say about cell phones, Jim? We hope, our goal is to try to get these things all turned around with all due speed. Please stay tuned, bookmark the CFSAC website, where we will let you know as soon as those resources are available what the archive website is for the webcast, and as the public comments are posted. In addition, I'll remind when we get to the comment session, if you are presenting your comments, if you have not sent us the written version, please either leave a copy with us or be sure you send that to the CFSAC mailbox, because we like to have that complete set available to everyone for their reading and review subsequently, because it is a matter of record for this meeting. Y'all have been wonderful. We've gotten great participation from the May meeting. A few folks checked and said, my comments weren't there. And, as you can imagine, in the chaos of arrivals and intake and all, things happen, but we got them right up as soon as we learned about it. So we appreciate that from everybody. Okay, let me turn then to Deborah Willis-Fellinger for the HRSA ex officio update. Keep talking, they'll turn it on.
All right, thank you. Thank you. Good. Thank you, Wanda. I appreciate the opportunity. We always appreciate the opportunity to participate in this advisory group, this advisory committee. So from HRSA, I don't know how many people are already familiar with HRSA, but very quickly I'll give a quick overview. HRSA is the primary federal agency for improving access to health care services for people who are uninsured, isolated, or medically vulnerable. And we concentrate on improving access, and that's through workforce and through facilities, making facilities for healthcare services available in communities, and by targeting quality and encouraging quality improvement and quality care. So with that, HRSA provides clinical care for about 20 million people, and that's more than Kaiser, which is about 8.5, and the VA combined, if you think about it that way. And about 1 of every 18 people living in the U.S. relies on HRSA-funded clinic for primary care, including about 1 in 3 people with incomes below the federal poverty level. Over the agency, within the Community Health Center program alone, there are approximately 8,400 physicians and about 5,100 nurse practitioners and physician assistants and certified nurse midwives that work in those programs. All of those programs have an emphasis on multidisciplinary clinical workforce designed to treat the whole patient through culturally competent, accessible, and integrated care. So there's a major focus on team management and as well as patient-centered care through those programs. And many of those health centers also provide educational opportunities for the next generation of clinicians. For those who aren't familiar, it's even possible to go onto the internet to find a health center in your area. That can be found at www.hrsa.gov, and then by clicking on in the right-hand one of the right-hand top boxes, healthcare regardless of your ability to pay. There's a box called Help, and you can click on that box and click on healthcare and put in your zip code, and you can actually see all the programs that are within your geographic area. So in addition to community health centers, HRSA also supports health professions training. It supports scholarships and loan repayment to clinicians in return for service in needy areas. Targets support for rural health care delivery, and rural community health challenges are addressed through those programs. Emphasizes quality, I mentioned that, and measures performance. Emphasizes culturally competent communication. There's training for providers associated with that, and promotes adoption of health information technology. So we were able, through the ARA funding that we received last spring, that funding targeted increasing jobs and increasing access through the health centers primarily, and about $2.5 billion actually is directed toward HRSA, and about $2 billion of that will be targeted to health centers and expanding access to care. Within a few months of the legislation, about $155 million of that had been released to establish 126 new health centers around the country, and expand hours, $338 million to expand hours and expand current services and add staff. And an additional $850 million went to expand physical sites, build additional facilities, buy equipment, and implement health information technology. So a major expansion then of those programs over this last few months. And within 6 months of the ARA funding, an additional 750,000 people in about 39 states and 2 territories have already benefited from the increase in access to health care. Other results of the ARA funding, the National Health Service Corps has expanded. And for those of you that don't know, the National Health Service Corps is about 39 years old or so program. And it provides recruitment incentives for clinicians through scholarships and loan repayment, and